Welcome to Lisa's Life Over 60. I'm here to follow up on the part 2 of You're Just Diagnosed with Cancer, Now What? There was 9 questions that we talked about to ask your physician or your oncologist at the first appointment. And so for that first appointment, these are some of the things that you're going to have with you for that first appointment. But I wanted to get the 9 questions down and put it in 2 parts so it could be baby steps. In this, the first thing that you'll do is get a notebook, just a spiral bound notebook. And you will put the top questions, how you want them in order after watching the last video of 9 questions to ask my oncologist. And leave space through in between those to write the answers. And it's best to carry a friend or someone that you trust with you to the doctor's appointment, so y'all together can ask the questions and let the friend or the person with you write down the answer, because this is so much to absorb at one time. And it's going to seem very confusing, and sometimes they'll use terms that you're not familiar with. So take your time, ask the questions, and don't be rushed, because they are there for you, and this is your body, and you need the answers to make you feel more comfortable in this journey. When you get those answers at the doctor's office, give it a day or 2, just put it to the side, and take a deep breath, and then reread it and see what you don't understand, what you do understand. And do not Google. Don't Google. It will scare you. If you have a bad cold, it's going awry. So please don't Google. Instead, go to cancer.org, cancer.org. It's American Cancer Association, and set up an account. You can put your diagnosis and information in there, support groups, valuable information within that one website. So please only use what the oncologist office gives you as far as material and guides, and cancer.org. Do not Google. I don't care if it's Mayo Clinic. I don't care if it's Harvard. It doesn't matter. It just makes everything confusing. So stick with cancer.org. Another thing that I found, that when you start talking about your diagnosis to people, sometimes you just get over it and you don't want to talk about it anymore. But your friends will say, just for instance, if you have been diagnosed with lung cancer, well, your friend has somebody that had lung cancer, but little did you know theirs was breast that went to the lung. So there's so many different choices and treatment plans. So if somebody starts saying, well, my friend say, I'm keeping this with my physician and I really don't want to talk about it. Instead, let's talk about the park's having a concert this weekend. Would you like to go? Just move on to a different subject, because don't make your diagnosis your new personality, because you're still the same person that you were. You're not the diagnosis. So try to not make that the subject of everybody that you walk into that knows. If they want to talk about it and you don't. It just stirs up a lot more confusion. Stay focused. Talk to people that can make a difference in your diagnosis. If they can't make a difference in your diagnosis, don't talk about it. Don't let negative energy fly through the air. Instead, talk about personal events. So remember, you are not your diagnosis. You're still the same person that you were before you got that diagnosis. What is a nurse navigator? A nurse navigator is there to take you. The physician will sit down and talk with you. And that's one of the questions is, do I have a nurse navigator and dietitian that will follow me through my treatment plan? If you do, write down their name and number, and you will have immediate access to that nurse navigator. And the nurse navigator should reach out to you if she does does not, you reach out to her or him, and they will give you valuable information, guides, steps. If you like to be organized, some of them have a packet of information that's really good and centered for your diagnosis and your stage, that you can keep your treatment plans, your physician's names and numbers, because you could have your oncologist, which is the driver of the ship. You could have a surgeon. You could have a radiologist, many different doctors that help you through this plan, not just one, because you have a team that's built especially for you. You need to have an oncologist that you're comfortable with. So don't think if you go to one oncologist that you have to stay with that oncologist. If some people just don't work well together. So don't be afraid to say, this is really not working. I appreciate everything you've done, and get another oncologist, because it's okay. It's your decision, and it is your body. Okay, and to go back to what the nurse navigator does, I kind of went down a rabbit hole there. The nurse navigator is there to advocate for you. She's usually in your specialty. A nurse navigator has been a floor nurse, has worked in oncology for several years, has hung chemo, has done all of those things that the oncology nurse does. And then they move into a position where it's almost like a mediator between the physician, the nurses, the physical therapy, the radiologist, that kind of center around and she's getting information, or he's getting information from everybody, and keeping that information where you're up to date. So if it's a simple question like, hey, I can't get a hold of the doctor today, this is what's going on, and the nurse navigator can say, you need to call the nurse and you need to leave a message because you need to talk to your physician. Or she can say, you don't understand about your radiology appointment today, let's talk about that. And then she can get the information, and it's almost like translating it to you, because the physician can come in and use a lot of very large, complicated words. And the nurse navigator has the time that she can really sit down and talk with you and go over the plan that the physician has put in place. That's where a nurse navigator comes in, because she's not only experienced in the field, she knows what the plan is that the physician has put in place, and she is just there to reinforce and support any questions that you might have about that plan. And remember, as I go through all these things, these are just things that comes into my head that I remember that patients would ask me. So these are opinions of mine as a retired oncology nurse, and I'll be happy to answer any questions that I can. Leave it in the comments, and I will answer every one of those questions. And together, we can do this thing called life. It's one step at a time. Sometimes when you're in the middle of a new diagnosis, it feels like everything is spinning. Take one event at a time. And the more you're educated and the more questions you ask, the better you will feel about going forward. You'll know what to expect in that next appointment, and it won't be as scary as if you don't have any information at all. So thank you for spending your time with me today. I know it's valuable. Take care of you, be kind to yourself, and let's do this thing called life together.